First and foremost, we think it starts with terminology. In healthcare, we have historically always called those that work in that field as vendors. And that has a pretty negative connotation with most, including the industry community. And so we first and foremost said we want to change the terminology because words matter, and words have to be congruent with actions. The second thing that we did was we went to the board and said, let's change the bylaws so that they match what we're trying to accomplish. Because frankly, the innovation of products and technologies comes from industry. Now, some of the ideas and the clinical validation and the input does come from the AHVAP member and our clinical partners at the bedside, and we're extremely thankful for that. But we also need our industry partners. And so we went to the board, they unanimously agreed to update the bylaws, and then that passed pretty much unanimously by the membership, which was a huge feat because they saw the value of that collaboration.
This is Associations Thrive, the podcast celebrating successful associations and their leaders. I'm your host, Joanna Pineda, CEO and Chief Troublemaker at Matrix Group International. Listen in as top association executives tell all, revealing the creative and innovative ways they're increasing membership, generating revenue, nurturing engagement, and reimagining their organizations. By the way, if you've launched a new initiative, created new member services, or updated your governance structure and are seeing great results, I want to hear your story, and so do my listeners. I'd love to have you as a guest. Go to podcast.matrixgroup.net and apply to be on Associations Thrive. Now let's dive into this week's show. Today, I'm speaking with Dr. Hudson Garrett, Executive Director and Executive VP of the Association of Healthcare Value Analysis Professionals, or AHVAP. Hudson, welcome to the show.
Thanks so much for having me. It's a pleasure to be here with you.
Hudson, tell us about AHVAP.
So AHVAP is actually 20 years old and is really centered around driving exceptional value across the healthcare continuum to both patients and healthcare providers and healthcare systems alike. It's a very interesting nucleus of healthcare providers, healthcare professionals, industry, as well as patients.
Hudson, what is a value analysis professional? Who are they within the healthcare system?
It's a great question. We're often asked even what healthcare value is. And I think the perception is different depending upon who you ask. We're all consumers and receivers of healthcare services. And I think we all agree that we want exceptional value for our healthcare. So as a consumer of healthcare services, as patients ourselves, we want the best possible value, the best possible experience, and the best possible care. And our patients want the same thing. And so healthcare value analysis professionals are both clinicians and non-clinicians. They're industry partners. And we also work with other individuals like the Food and Drug Administration, the EPA, and the CDC to really deliver exceptional value through the delivery of healthcare products, services, and really procedures right across the healthcare continuum.
So Hudson, if I'm a doctor, can I also be a value analysis professional, or is this a specific role within the healthcare system?
That's a great question. So, years ago, the value analysis profession was really centered around nurses, and that has tremendously changed. So in the last 15 to 20 years, you've seen many different disciplines, healthcare laboratory professionals, infection preventionists. We've seen healthcare logistics, supply chain professionals, physicians, pharmacists, professors, economists, all of the like have come into the profession. We still have the majority of our field still has some type of clinical background, but that is changing. But we've seen a tremendous explosion of providers, specifically physicians, become involved. And we find that that's really important because we know that physicians especially are driving sort of the head of the clinical care. And we've even had an organization recently, McLeod Healthcare in South Carolina, has actually had all of their physicians that sit on their value analysis committees have joined AHVAP. And so there's really a place for everyone. And we've sort of developed customized resources to ensure that each of those professions has something specific for their discipline to make sure that they can thrive within our association.
What kind of training does one get to become a value analysis professional?
Well, That's an interesting question because until recently, there weren't actual formal competencies. And so at AHVAP, we've worked with our Education and Clinical Practice Committee to really draw two lines in the sand, to your point. The first was to define what the specialty is and what it's not, because both of those are
Ah,
equally important. We have to say what we are standing for and what we're trying to accomplish. And it's really around those concepts of cost, quality, and outcomes. And it's not cost first, it's outcomes first, because it always is the patient that comes first. When that patient is in the bed, the healthcare value is what we're trying to deliver. And we certainly want to have a good quality outcome. We want to make sure our process is reliable and it's highly redundant, because we know that, especially with supply chain challenges that we've all experienced during COVID and post-COVID, that can be a real big issue for us from the supply chain perspective. But we also want to do it for the lowest possible cost so that we can reinvest those dollars elsewhere across. So that was number one. Number two, as you can imagine, was to create a competency so that we can say, well, if you're new into the field, here are sort of the expectations that you need to be able to deliver upon, right? Here's the core competencies for this type of role. And that's really at sort of the basic level, that beginner, novice, and advanced. We're in the process also of validating this for that advanced practitioner level. And we also have a board certification that helps to validate those cognitive competencies, which we found tremendously helpful to, especially for employers, to really say, this is somebody who has really demonstrated competency in the specialty as well for hiring and promotional purposes.
so I don't know if this is a fair question. And obviously, when you go to a hospital or go to visit a doctor, you want to get the best care possible so that you get better, you feel better, you're healthy, etc. But sometimes the patient experience varies greatly. You might have a great doctor, but the whole experience at the clinic was terrible. Does value analysis take into account the patient experience, just how you were treated, how you got through the forms? I don't even know if this is a fair question.
I think it's an absolutely fair question. And let me give you a tangible example that I think we can all relate to of something super simple. So let's imagine you have a relative that's in the intensive care setting at your local hospital, and they're there for 3 to 5 days for a procedure, and they're hospitalized, right? Obviously, you want that relative to have a bath. Something as simple as a disposable bath cloth that the nurse is able to heat up. If we go down the route of getting something that's sourced through the value analysis process that's not clinically evidence-based, let's say that it's not the most comfortable thing for your relative's skin. Maybe it doesn't heat equally, and so it's cold on some of the ends, and so it's really cold for your relative who might be sedated, as an example. Well, that's going to be a negative impact to your patient's experience, right? To your relative's experience.
Ah,
And yet that's something that may cost a few dollars. And so often the value analysis professional is saying, wait a minute, it's not about the cost. It's about the patient's experience, their entire experience that they have with that episode of care. And so whether it's the IV catheter, the Foley catheter, the bath cloth, the oxygen tubing, whatever it may be, that value analysis professional is looking at the entire episode of care, all the tools and resources that are needed to deliver the care. Now, they're not the one delivering the care, right? That's the nurses, the physicians, the technicians, and the specialists that are at the bedside. But they're behind the curtain, making sure that the right products are there for the right patient at the right time and for the right cost. And they're relying upon the input of those frontline stakeholders clinically to say, do we have the right tools and instruments to deliver upon the promise that we have to our patients? And again, I think we all want excellent care. I know I don't want mediocre care. I don't want average care. I want perfect care. And so that's what we strive for at AHVAP, is to make sure that our members can deliver perfect care for their patients.
it sounds like you need an interdisciplinary team to be able to provide this excellent care across all these different disciplines.
That's correct. And, if you think about the healthcare continuum, what makes AHVAP very unique is, healthcare is not just delivered in the four walls of the hospital. It's delivered in long-term care facilities. It's delivered in the home, the medical home, which is a huge model. It's delivered in skilled nursing. It's delivered in other areas, right? You've got rehab facilities. It's pharmacies. It's retail. Healthcare is delivered in so many different places. And as my younger brother, who is a malpractice attorney, always reminds me, it doesn't matter where healthcare is delivered. The standard of care is still the same. Safety trumps everything. And I totally agree with him. I rarely agree with attorneys, but this is one time I really do. And he makes an excellent point, because our role in healthcare value analysis is to make sure that regardless of where the patient receives their care, they still have the exact same expectation and delivery of safety. The other thing that we're working very hard on at AHVAP is to make sure that everything that we do has high reliability, because that safety is really of paramount importance for what we do. While not all of our members are clinicians, they still are 100% committed to patient safety and healthcare safety. And I think if there's one thing we learned through COVID, it's not just the term patient safety. As a matter of fact, I don't even use that term anymore. It's healthcare safety. Because guess what? If we have a bed, but I don't have a nurse that's able to take care of your loved one, well, then we have failed.
Right.
It's not just about the patient. It's also about making sure our caregivers are also safe and they have the necessary PPE or the protection necessary to go to work and they feel like they're cared for. And so there is a tremendous evolving role, even with supply chain disruption, for our members to play to make sure that healthcare team members also remain safe.
And I had Dr. Devin Jopp on the show a few weeks ago, and he said that infection preventionists, who are his members, really think about the patients, but also the health and wellness and safety of the healthcare associates. And that's exactly what you just told me. It has to be the entire system that we're looking after.
Right. As a proud member of APIC for many years, I can appreciate where Devin is coming from, because the infection preventionist is really that subject matter expert to say, hey, we need this type of gown, we need this type of mask. And the value analysis professional or leader is the one that's responsible for the sourcing. Right, to make sure that we're incorporating that feedback. And they work with, for example, the perioperatives team to say, what level gown, what level of equipment do you need? Are we meeting the ARN guidelines as an example? So value analysis reaches across all of healthcare. And I tell people, the best way to think about your value analysis is when your patient, your loved one is admitted to a hospital, there's very few departments that touch every single admitted patient. But environmental services does, right? The people that actually clean the rooms. Nursing does.
Right.
Dietary does, because we feed all the patients. And really value analysis does, because the products that are used are sourced by clinical supply chain, value analysis. And so it's going to be a department that does directly touch every patient.
Well, thank goodness there are people like value analysis professionals who are thinking about these things. I had not heard of the profession. Hudson, we're going to talk about the things that AHVAP is doing to thrive, and thriving you are. But before we do that, let's talk about your journey. How'd you get to become ED?
Well, that is an interesting story. So I've worked with associations on and off in different capacities. I started off as a board member about 17 years ago with the Vascular Access Group. Started off as a vice president for an inaugural certification board, then worked for a regular certification board, and then moved on into a long-term care. Started as a consultant, went back to a different capacity, and then started working with AHVAP primarily on their certification side. And it ended up expanding into a role where they asked me to take over management services for the association with some expanded capacity. And I really have to commend the board of directors to say we wanted to do something different. We wanted to be bigger, badder, and better. And we wanted to look futuristically into the different specialty area to say, how do we sort of expand the role of value analysis? How do we make sure it's ready for what the new healthcare needs, right? This sort of post-COVID pandemic. I think value analysis was probably the most significantly impacted specialty within healthcare in terms of supply chain disruption that managed that. And so the timing was good. It's been quite a journey. As a matter of fact, I just actually earned my CE earlier today.
Oh my God, congratulations.
Yeah, I just got my results earlier. So it's been a journey that I would not trade for anything. But if you asked me 5 years ago, if you thought I would be here, I would probably not have said yes. But it's something that I think has been quite exciting. And it also gives you an opportunity, I think, individually and professionally to contribute on a broader scale, because our patients desperately need a different type of healthcare, and AHVAP is ready to step up and deliver it.
Well, Hudson, you actually wear a couple of hats, which I find really interesting, because you're ED of this association, but you're also CEO of your firm, your own firm, Community Health Associates. So how does that work?
My clinical specialty is in clinical infectious diseases.
Hence the APIC membership.
Yeah, absolutely. So I've been a longstanding member of APIC. And so, very excited to see Devin take on that role as CEO of APIC. My whole goal professionally has been to reach across disciplines, frankly, to reach across barriers that have existed in healthcare. My main frustration in healthcare, both as a provider and as a patient, has been there's been a lack of facilitated interprofessional collaboration. And I'll just give you a tangible example. When you go to the doctor, right, and they're sitting there typing away and entering stuff in the electronic health record and not listening to you and not talking to you. And, one person puts you on a medication, and we see this often with the elderly, and they're on 15 medications.
Right.
There's no one talking to each other. And so my whole goal professionally has always been to say, how do we take the same problem and work across multiple associations, disciplines, professions, whatever it is, to actually resolve the issue?
Ah,
And so today, maybe you and I are talking, and maybe tomorrow, Devin and I are talking, and maybe we're talking to ARN on Monday. We're all talking about the same issue, but the difference that I try to use in my approach is I'm not afraid to run through barriers, walls, go around the walls. It doesn't matter. I'll jump islands, whatever it takes to make sure the patient and the healthcare provider is safe. And so that's been my deliberate approach. And so I've always enjoyed my consulting practice where I take those issues, dissect them, and make sure I bring the right people to the table. My whole strategy has been to build dinner tables with the right collaborators, people that want to solve the challenge, and to facilitate opportunities for collaboration. And I really see my role with AHVAP to be a complementary piece to that, because that's what AHVAP's all about. The board of directors is probably one of the most talented groups of individuals that I've worked with, highly strategic, very, very motivated, and they get interprofessional collaboration. And so it's been an absolute journey that I'm quite excited about.
Well, Hudson, let's turn to AHVAP because you're doing all kinds of amazing things. And it strikes me that in healthcare, it takes a collaboration between the clinicians, the non-clinicians, and the industry partners. And you're doing some different things with the industry partner collaborations in the industry that you think are really shaking up the industry for the better. So talk to us about that.
Well, first and foremost, we think it starts with terminology. In healthcare, we have historically always called those that work in that field as vendors.
Ah, yes.
And that has a pretty negative connotation with most, including the industry community. And so we first and foremost said we want to change the terminology because words matter, and words have to be congruent with actions. The second thing that we did was we went to the board and said, let's change the bylaws so that they match what we're trying to accomplish. Because frankly, the innovation of products and technologies comes from industry. Now, some of the ideas and the clinical validation and the input does come from the AHVAP member and our clinical partners at the bedside, and we're extremely thankful for that. But we also need our industry partners. And so we went to the board. They unanimously agreed to update the bylaws, and then that passed pretty much unanimously by the membership, which was a huge feat because they saw the value of that collaboration.
So what was the change in the bylaws that you enacted?
Yeah, so we changed the actual membership classification in terms of the terms. We changed the actual, they are now voting members.
Ah.
And we gave them the ability to fully participate in all activities of the association for the first time.
So you're recognizing that they are full members of the profession, contributing fully to the profession.
Absolutely. And we found that that is critical to success. Now, let me be very candid, though. There's going to be some disparity between vendors and industry partners, and we recognize that. And we were very frank when we had our sort of rollout meetings and said, there will be some that will not rise to that occasion. And we understand that. We're not disenfranchising those. But our expectation is that as healthcare evolves and changes and our healthcare needs become bigger and bigger, that we see a pendulum shift towards those that will become an industry partner. And there's going to be great reward there because that means that we have a greater level of strategic partnership between our healthcare facilities and those partners. And an industry partner, for example, is the one where when your entire sterilization department blows up and is underwater at 3 a.m. on a Sunday night, and you call them and they say, don't worry, I'm on the way and I'm sending help.
Yeah.
That's a strategic partner, right? Versus the one that says, let me refer you to the 800 number at customer service that's closed on the weekends.
Right.
That's a vendor. And so that was really number one. Number two was we created, again, what the definition of an industry partner was. And we did that in collaboration with them. So we brought them into the room and said, we're not doing this in a vacuum. That's not fair. We brought an industry partner group into the room, including our board member, who is a voting member of the board that represents industry, and said, let's talk about this. And lastly, is we created competencies just like we did for our profession.
Ah.
So we actually have that disseminated, and it's all public. And we created a code of conduct to make sure that we prevented undue conflict of interest. And we're really proud of that because it's allowed them to be a part of the AHVAP family, to be a contributor to it, and to really sort of come into the tent versus being an outside member.
Hudson, you're a credentialing organization. Is it the case now that you've got credentials that different roles within the industry, within the profession can now get, including industry partners?
So we have a board certification for value analysis professionals that even industry, if they meet certain criteria, are qualified to take.
Regardless of the context in which they work.
Correct. So as long as they meet the core competencies and the 3 years criteria, we do have industry partners that can actually take that. As a matter of fact, we have a whole separate certification board of directors, and one of those members is from industry and is certified. So I don't remember the exact numbers, but we have multiple members from industry that hold the certification. We've also got micro credentials that anyone can take as well. And we're getting actually ready to launch a brand new program specifically for industry professionals as our partners. That'll be launching at our annual conference in September.
Man, I love this because, I'm a member of some organizations and some label us vendors and some label us partners. And partner, obviously, like you said, words matter. And I think that the organizations that really see themselves as fully part of the community and fully contributing to the profession, they're the people that you want as partners. But you got to welcome us, right? Otherwise, we feel like always the outsiders.
Right. And, we had this same due structure previously for our vendor or our affiliates is what we called them before with our regular members. And yet there was a difference in the actual member benefits. And our board, specifically our president at the time, had a fundamental problem with that. And I did as well, because if you're charging the same thing, you need to get the same benefit. And we also need to have the same expectations of clarity and professionalism and accountability across the disciplines. And so just as we treat nurses and physicians the same, we're going to treat our industry partners with the same level, especially with our code of conduct. And so we now hold everybody to the same standard because we find that that is really the best way to solve some of our complex challenges across healthcare.
Wow. Well, let's turn to something else. You say that credentialing is really important to AHVAP, and you're doing some really interesting things there. Tell us about that.
So we have actually sort of moved the pendulum a little bit and said, what could we do from an innovative perspective to meet the needs of our members that are a little bit different? And so primarily we have a board certification, which our members are always trying to achieve. And that's sort of the core standards, our certified value analysis healthcare professional or CVAP designation. That requires 3 years of experience and they have to have certain criteria to do so. But after that, there was really nothing for them left to achieve. And so we also had people that said, I'm looking for more detailed knowledge, for example, on medical device safety or healthcare communication or supply chain disruption or infection control. And so we said, well, you know what? That's a great opportunity for us to allow a micro-credentialing program that's specific to those core topics. We've actually developed a total of 5. By the end of next year, we'll have a total of 13 of these, which if you follow the credentialing space, that's a pretty aggressive number.
That's a lot.
It is. And each time we open up these cohorts, they sell out each time. And so they're all facilitated by live expert instructors. We pulled from across both our membership as well as external experts in the field to provide some truly world-class instruction. And so they earn a digital badge. They earn CEUs for both nurses as well as our CVAP designation. And some of them require recertification, some of them don't. But they are all practical application case-based learning. And so we've got 4 basic programs, and we just rolled out our advanced signature program, which is more like a master's level program, and all of them are under 8 hours.
Ah.
They're really specific to topical areas. So we have one on healthcare communication and collaboration. We have one on supply chain disruption, medical device safety, infection control. And then we just rolled out our new program, which is advanced medical device safety and risk management. And they have all been extraordinarily well received. And we have folks from across our entire membership, industry partners, clinicians, non-clinicians, and non-members that have taken them.
So what you're doing is you're really saying, on top of the main credential, you can really add to your knowledge and I guess your experience with all of these different micro credentials.
Correct. And if you look at the Institute for Credentialing and Excellence, which we're a member of, and sort of the best practices, they're called stackable credentials. And so they're really designed either if you have the existing credentials, the sort of baseline, or you stack it upon your experience. And so we know that each of our members has a different pathway, some traditional, some not. And so our goal is to be as agile as possible for those individuals as professionals. So maybe you have a bachelor's, maybe you don't. Maybe you have a graduate degree, maybe you don't. Maybe you're certified, maybe you don't. This allows every member an individualized educational and professional development experience. And we've sort of matched that with our career coaching options so that if you're looking to go to a director role or a VP or AVP, we have something that allows you to customize that experience and really is more unique for you that still allows you to promote that. The other thing that we're doing that I think is quite unique is we'll work with health systems to say, what are you trying to accomplish for your teams? And then we can customize professional development plans that will build in this credentialing program for each of the team members based on where that person is in their professional growth journey. And that's been quite well received as well. So we're trying to be as outside of the box as possible, recognizing that what worked 5 years ago is not going to work today.
Yeah.
And what's working today is not going to work tomorrow. And we've got to be as flexible as possible for our members.
So what's been the result on membership?
So just in the last 18 months, our membership has tripled.
Oh my God. Because of all this new activity, the credentialing?
I really do think it's a combination of an enhancement of member services. We made some changes, certainly in customer service. We've added the micro-credential programs. We've made significant improvements to our credentialing program in general. And honestly, we're just changing the way that we interact with our members to make sure that they have what they need. You know, part of the association's job too is to look futuristically and say, what does the profession and the member need tomorrow? So that we're well ahead of that and we can arm our members with those tools and resources to be successful in the future. And so we've also spent a good amount of time as a board to make sure that we're thinking about that 5-year strategic plan and aggressively moving that forward so that we've got those tools and resources too.
Well, speaking of the future, you've got a future summit coming up in the next month. What's that?
So we're quite excited about that. It is our first Future Summit, and it's going to be held July 12th in Charlotte. And it's really designed to look futuristically, as the name implies, into really the next 10 years. And so we've convened a group of experts across all aspects of our membership, including some folks from outside of our membership. And so we've got industry professionals, health systems, both adult and pediatric. We've got sort of a cross-section of our board of directors. We brought in an academic professor to sort of think about this from a research and outcome standpoint. And we have also brought in partners from the Association of Perioperative Registered Nurses, because that's one of our strategic partners. And so our goal is to bring this sort of think tank together we've got some topical areas that we're going to explore with discussion-based sort of case examples that's going to be led by the different members of the cohort. And really at the end to sort of publish the proceedings and talk about where can we go from here? What's needed? How can we sort of move that needle and that pendulum forward? And our sort of expectation is to repeat this exercise on an annual basis and to keep sort of the structure, but certainly we'll update the stakeholders. Certainly there'll be board member consistency, but we'll change the people that come in. So we're always getting fresh perspectives in that think tank process. But this will be made public. And we'll really use this to supplement our efforts in our strategic plan, but it'll also be sort of the basis for some curriculum development and then also be used for our fellowship program that we also launched this year for the first time.
Well, Hudson, will you come back and talk to us about what happened at the Future Summit? Because I think my listeners are going to want to know.
Absolutely. Yeah, we're quite excited about it. And, again, I think as patients, we've all got to be excited about helping to fix healthcare. And our whole goal at AHVAP is to fix healthcare from the inside. And I think that when you have that practical approach and you're always willing to have the tenacity to do that, there's some really exciting things possible. And at AHVAP, we're really excited.
Hudson, this was an amazing interview. I learned so much. I did not know about value analysis professionals, and now I do. And I know that I have another set of professionals to thank whenever I enter a hospital or a rehab center or another healthcare facility. And I'm looking forward to our next interview where you can tell us about the Future Summit. So thank you for everything that you've shared and congratulations on your success.
Thank you so much. You may not see us, but we will always see you when you're in the hospital, and we always look forward to taking care of you.
Thanks for listening to Associations Thrive. We're so glad to have you here. You know, my personal mission and the mission of my company, Matrix Group International, is to help associations and nonprofits increase membership, generate revenue, and thrive in the digital space. I want to hear stories of how your organization is thriving in today's challenging landscape. Please apply to be on my show by going to podcast.matrixgroup.net. By the way, do you need help with a digital initiative? Maybe it's a website redesign, a new membership database, or a hybrid meeting that you're planning. I'd love to connect with you. Please visit the Matrix Group website at matrixgroup.net. Thanks again for listening to this week's episode of Associations Thrive. Don't forget to subscribe to the show, leave a 5-star rating, post a comment, and share it with your colleagues and friends. Bye!